Hi friends, Namaste. I'm Dr. Manjula S, Patil, Consultant Obstetrician and Gynaecologist, working at Motherhood Hospitals, HRBR Layout, Bangalore. In this video segment, I'll be giving you information about the Oligohydramnios. Majority of you, when a scan is done either in the second trimester or in the third trimester as a growth scan, which can be about 28 to 30 weeks or again between 36, 37 or 38 weeks, we do come across a report saying there is a reduced fluid around the baby. So what exactly is this reduced fluid around the baby or oligohydramnios? And what are its implications and what are the things that we really want to do the moment we see such reports? So oligohydramnios is nothing but reduced amount of fluid that is considered to be minimal for any particular period of gestation. And assessment of amniotic fluid is done by two ways. One, the clinical assessment, and second thing is by ultrasonography. Coming to a clinical examination of amniotic fluid, on a day-to-day basis, when we'll be examining a patient, we'll be indirectly assessing what may be the size of the baby that is growing and the amount of fluid around the baby, which may not be that precise. But then clinically, when you grossly suspect such abnormalities, then we'll be asking you to go ahead with the scan again, which will guide us regarding whether is there any actual oligohydramnios or the reduced fluid around the baby. So the normal amniotic fluid measurement is done by either a semi-quantitative assessment or a quantitative assessment. A semi-quantitative is what we say by an experienced radiologist or a fetal medicine consultant. The moment they start doing a scan, they'll be able to feel that there appears to be a significantly lesser amount of fluid around the baby. And after which sometimes we'll go ahead with the quantitative assessment, or in general as a routine to make it more standard, quantitative assessment is done by two means. One, the amniotic fluid index, or the second thing what we call it as a single vertical depth or deepest vertical pocket of amniotic fluid that is normally being measured. Amniotic fluid index less than 5 cm taken as oligohydramnios, or the single deepest pocket less than 2 cm taken as oligohydramnios. Coming to the implications of oligohydramnios, again it depends on what is the cause that is responsible or what is the period in which we are noticing this reduced amniotic fluid, and our management again depends on all of these factors. Coming to the etiology or the cause for this reduced amniotic fluid. As I told in my first video segment of the normal formation of amniotic fluid, majority of it is basically by fetal urination. So any structural abnormality that leads to abnormal functioning of the kidneys are functioning normally, but then it is not getting excreted because of the obstruction in the pathway of the urine, which can be in the bladder or it can be an outlet of bladder, what we call as a urethra. So if there is a posterior urethral valve, or if there is any blockage anywhere in the following bladder, or even if there is a rarest possibility of atresia or the non-development of the bladder, these are the things which can lead to reduced amniotic fluid. And second other major component of fluid, as I told you, is basically a lung fluid. So if there is any obstruction for the outlet of this lung fluid, can also lead to a oligohydramnios or the reduced amniotic fluid. But on the other hand, it can also lead to excessive fluid around the baby as well, when there is a abnormal communication between the lung as well as the foot pipe, that is a windpipe and then as well as the foot pipe. Coming to oligohydramnios, so the major causes, as I told you, are basically one, the abnormal or the renal pathology. In more than 40% of the cases, there may not be any obvious factor. The oligohydramnios can be due to maternal causes, it can be due to placental causes, or it can be due to fetal causes. Maternal causes for oligohydramnios are the conditions in which either it can be obstetric complication or can be a medical complication that leads to a reduced amount of amniotic fluid, which can be conditions like severe preeclampsia, or can be a diabetes with a significant vasculopathy, where you tend to notice a reduced growth of the baby as well as a reduced amount of fluid around the baby, Other things, if mother is on any particular medication, some of the medications which can lead to reduced amount of fluid around the baby are also a cause of concern. So these are the most common maternal causes for the amniotic fluid. Coming to the fetal causes, anything that leads to reduced fetal urination secondary to reduced baby growth as such can lead to oligohydramnios. There are good number of times, that is in more than 40% of the cases, these are idiopathic, where we won't be able to identify what exactly may be the cause for oligohydramnios. So coming to how are we going to evaluate the oligohydramnios? As I told you, either it is a clinical examination that has led us to diagnose or evaluate for oligohydramnios, or incidental finding when we are doing a second trimester scan or a third trimester scan. So if you notice oligohydramnios in the routine anomaly scan that we do in the second trimester, so when you have a suspicion of oligohydramnios, we'll be taking a detailed maternal history. Followed by that, important thing is basically assessing a detailed anatomical survey of the fetus. Our purpose here is basically identify what may be the factor leading to oligohydramnios, and then how are you going to manage it further. So coming to the factors leading, the first thing we need to rule out the obvious, if there are any renal problems, or sometimes it is an association of structural abnormalities along with that chromosomal abnormalities, more so if oligohydramnios is noticed in the second trimester. Other important factor that we need to assess for oligohydramnios is basically a premature rupture of membranes, or the leaking, that mother has a complaint of leak per vaginum, the amniotic fluid that's been drained, that can lead to oligohydramnios. So if you broadly categorize the factors or the etiology responsible for oligohydramnios, can be one, the renal abnormalities, and second thing is if it is following a leak, and the third thing is it can be majority of times, more than 40% times there may not be very obvious reason, what to call it as a idiopathic. So once you have a suspicion, a detailed anatomical survey is done. After that, management basically depends on, as I told you, management as well as a prognosis depends on when oligohydramnios has happened and then what are the causes for it. If the oligohydramnios is due to any of the fetal structural abnormalities and it is noticed in the second trimester, majority of the times it has a very bad prognosis, basically because of the structural abnormality, and sometimes there will be associated genetic problem with the baby as well. So default, it is a rule, if you notice oligohydramnios in the second trimester, we need to evaluate to rule out any genetic problem with the baby, which we'll be doing by taking the fluid around the baby and then studying the genetic abnormalities in the fetus as well. If you notice that after evaluation, if it is just idiopathic, in which case our management basically depends on the period of gestation. We'll be just regularly monitoring the fluid around the baby in 1 to 2 weeks interval. Again, it depends on the severity of the reduced amniotic fluid around the baby. So crossing 37 weeks, whether we need to go ahead with the delivery, again there is a controversy and doesn't have a very clear-cut recommendations on that. But majority, once you cross the 37 weeks, our management basically depends on, we do counsel the patients regarding the continuation of pregnancy, and we also assess the favorability of the cervix, and based on that we'll plan to go ahead with the induced delivery. The complications again with oligohydramnios, if it happens in the later period of pregnancy, that is in the third trimester, if it is following a leak, we are much concerned about the chance of infection for the baby, which we'll be monitoring on a regular basis. Again, it depends on how much amount of fluid that is being drained. If it is a very trickle, there are a good number of times there is definitely a role for a conservative management of oligohydramnios, in which we will be regularly monitoring the mother regarding the amount of fluid that is being leaked, and then we will be checking for the signs and symptoms of the infection that a mother is developing. So anytime if there is a suspicion of an infection, we will plan to go ahead with the delivery of the baby. Depending on the period of gestation, we will consider to go ahead giving a steroid for baby lung maturity, or if she has crossed 34 weeks of gestation, we just plan to go ahead with the delivery by vaginal delivery by inducing or artificial stimulation for labor contraction, or if it is very much unfavorable and in a very early pregnancy, we may even consider to go ahead with a cesarean section. If the cause of oligohydramnios is idiopathic, Then monitor it till 36-37 weeks of pregnancy, and then assess the cervical favorability, and then plan to deliver the baby based on all these factors. Other complications that we notice with the oligohydramnios are basically in the intrapartum period, that is when you induce a woman for a delivery. Because of the reduced amniotic fluid, there are chances of cord compression leading to fetal heart rate abnormalities in the labor period, and thus increasing the risk of cesarean section in such babies. And very rarely, if it is majority of times not really well monitored, can also lead to a sudden fetal death. And other things are baby passing a meconium is also a commonest concern when there is a oligohydramnios. So in a nutshell, oligohydramnios per se is a not very dangerous condition, but it definitely requires a close monitoring. And if it is a severe oligohydramnios noticed in the second trimester, definitely has a very poor prognosis. But the similar thing, if it is noticed in the third trimester, requires a close monitoring and then timely delivery of the baby, and thus preventing a severe complication that can happen with the fetus. Thank you. Thank you for watching for all this information. So if you have any queries or otherwise also, I'll be available for consultation at HRBR Motherhood Hospital Monday to Saturday. Thank you.